Hi, this video is continuing to go over policies and guidelines for Helping Hands, kind of under the delinquency context. The one that we're getting ready to go over now is drug testing, which doesn't quite necessarily have to do with delinquency, but we've grouped it with this section of delinquent policies. So let's get into it. What is our drug testing policy? I guess I want to preface it this way first. Okay, so just keep in mind who Helping Hands serves. We serve those that could or could not have a history of drug abuse. We serve people that are coming out of incarceration, drug rehabilitation, domestic violence situations, and just financial hardship situations as well. But when you throw all that in, you think about the situation, the background, the scenarios. They're within the Helping Hands community. There's those who have suffered from, have had some form of drug abuse background, and so we just need to, just like a lot of employers do, we need to have a drug testing policy. We need to test and make sure that no one is secretly using drugs, abusing drugs, street drugs, prescription drugs, what's now known as like Jiffy Store drugs like Kratom, and even things like Kava are being abused now as well. Things that are easily accessible. And so what is our drug testing policy? It's across the board for every resident. What we do for one, we have to do for the other. Same thing with things like curfews. It's just across the board. It makes the operation of Helping Hands more efficient. It provides greater accountability for those that know they need it and those that may need it but don't think they need it, and so forth. It's just a very wise thing to do for more reasons than I just stated. Why do I say all that? Because I don't want anybody to be offended or have their feelings hurt when we require a drug test, that it's a statement of us of lack of trust, when the trust may be there, when there's clearly there's no fear on our part that someone is abusing drugs. But again, I just hope you understand it needs to be done across the board. Whether you do have a history of drug abuse, whether you've been with us for 1 week or 1 year, it's just something that we're going to do. So all that talking, and it's on the screen now. You may have already read it all. I don't know. But there's going to be an initial drug screen for every new resident done during the orientation process. But then there'll also be, that's the initial screening. There'll also be random screenings every 2 to 3 months for each resident. For every adult resident, we're looking for drug and alcohol, making sure that that's not present. Taking that a little further, as far as even an advantage for some people may have a legal case where they need to be drug tested, and we can help with that. If a resident has an open case that requires random drug screens, it is the resident's responsibility to inform Helping Hands staff. But at the same time, Helping Hands may then conduct testing at the required intervals. Helping Hands staff will then take pictures of the screen and will send it to the case manager for the resident. Now, again, that's just covering all our bases with random screenings. But what if there's a suspicion of someone that may be abusing drugs, that we're seeing symptoms or signs? Then there may be something that outside of or in addition to the 2 to 3 months. So suspicion. If Helping Hands staff has cause for suspicion that a resident is violating Rule C of the resident rules by doing such things as using illegal and legal mind-altering substances, abusing prescription drugs, consuming alcohol, vaping, or using tobacco, Helping Hands staff will require the resident under suspicion to complete a drug, tobacco, and/or alcohol screening at any given time. Okay. Proof of use. If there is a proof of drug use and abuse, should a resident be found to have drugs and/or alcohol in their possession, or in their system consuming drugs or alcohol, the resident will immediately be required to leave the Helping Hands premise and program. Okay, so that's our shortest video so far in the series of policies, and I'm going to stop there. Alrighty, thank you for your time and your attention.